Michaele Pride, Architecture.
Mike Rocca, Political Science and Master of Public Policy Program.
Karen Katira, Community Engagement Center.
Irene Vasquez, Chicano and Chicano Studies in the Southwest Hispanic Research Institute.
Francisco Viña, School of Architecture and Planning.
Jessica Carr, College of Population Health / School of Architecture, Planning, Design, and Planning Assistance Center.
Projecta Atul, School of Medicine.
Cancer Center.
And Cancer Center.
Lorenda Malone, College of Population Health.
One-time College of Education and Human Services.
Carol Ibarra Center, Office of Community Engagement, and I'm going to play a message that Professor Tim Castillo, he's not going to be able to be here, but he's sorry.
Good morning. I wanted to take the opportunity to welcome everybody to this wonderful workshop that Professor Wallerstein and Professor Pride are putting on. I unfortunately will not be able to attend, but I did want to send my regards and really excited about the first steps in developing a community engagement academy. We are very excited about the opportunity and really lean on the expertise of Nina and Michael. We really appreciate their contribution to our institution, and
Well, that's a welcome.
Days to fill in that blank.
Introduce yourself. Oh, gosh.
Hi, my name is Anish. I'm in media.
So when Michael and I were talking about this, we recognized that this is very, very much the beginning, and we just wanted to do something really quickly because they're being very gracious on my schedule because I go to Brazil February 13th and don't come back till April. So we wanted to kind of kick it off before. So thank you for being gracious for this fast gathering. And I go teach and do research at the University of Sao Paulo. So I'm going to present, and my colleagues here are from the Center of Participatory Research, Lorenda and Prajatka, and then Shannon is also very involved with us and wants to be, for those of you who know Shannon Sanchez-Youngman, wants to be involved with this, and Lorenda Malone and Prajatka Edsel. So just we'll kind of honor them as we go. I wanted to give a kind of overview of my thinking of how we should plan this, but I want to say from the beginning that we have different disciplines and expertise and knowledge in the room, and to really make this an interdisciplinary academy, whatever we want to call it, engagement academy, we are going to need everybody's interdisciplinary contributions. So I thought, though, it still would help to have some sort of framing, and then together we have to create a plan of how we will go bring in the knowledge and it's not just knowledge, academic knowledge, it's our lived experience knowledge, it's our knowledge out in the community, our practice knowledge, our knowledge of our work. I was just yesterday at the immigrant rights panel, and there was a lot of fear and talk, so this is even more important because there are students in the room who are DACA students, and there were professors who wanted to really help create a safer environment on campus. And I did learn, I think it's really important, I'm going to bring this to the college, Lorenda. Our university needs a policy on how we protect our students and people who are at risk, because we do not have one. And that means that we do not state which are the public and which are the private spaces, because private spaces are those which ICE cannot enter without judicial warrant. So that's huge. So I'm just saying, for us doing community engagement, we need to push forward from wherever to the president. I'm going to be writing Garnett Stokes to the president about what it means to create private spaces on campus, to create a protective environment. So it was a very powerful panel yesterday. It's not part of this morning, but it is, because that's what community engagement's all about. And we're doing a lot of national work, not international, a lot of national work with groups across the country, and every group we're working with is worried about the fear in the communities. So, and even Native groups, because ICE is picking up Native people. It's not just immigrants They are it's really terrible what they're doing. Anyway, sorry, I was really upset yesterday, so I'm just bringing that in and knowing that this group, of course, would understand completely and has the same values systems. So, okay, so no, we're going to the other one first. Michael.
Yeah.
I
I
couldn't
was
get
trying
my.
to make,
I
you couldn't?
I couldn't.
It's crazy.
So,
So what we do is just do a regular
sorry.
slideshow.
Yeah, that's okay. So I didn't know. It's Community Engagement Academy, I guess, but we're calling it a co-design group. We're the co-designers, okay? So, and I wanted, oh, it's not working. Oh, so there is a Carnegie statement that we're under. So community engagement, collaboration between institutions of higher education and all larger communities in partnership and reciprocity. I'll send out the slideshow, so I'm just gonna go fast. But just kind of, this is where it's all coming from, this reapplication for the Carnegie. UNM actually put our own Carnegie statement together. It looks kind of small to me, but University of New Mexico, so a dynamic and inclusive environment. So that's the whole idea of a public protective environment, an environment that protects our students. But this is in the Carnegie report that I'm part of this small committee with Carol and that's been writing this report. I haven't been writing, I've been supporting it. Others have been writing it. But addressing pressing challenges to promote social equity. Can we use the word equity anymore? Co-creating sustainable solutions. We can here, okay. Yeah. So community engagement as an essential aspect of higher education. So here we are. This is the report that goes in April, and we're trying to get this reapplication. So the kickoff of our co-design Community Engagement Academy is this report, this reapplication for design. So that's our framing. I wanted to kind of just say this is one model. I mean, there are many frames of so community engagement can start at this level. This comes from a medical model, and there's others. But it can start at just outreach, where we think we know everything and we're going to tell them what to do, right? I actually don't believe this is engagement at all, but it is in this model. But starting in consultation, involve, collaborate, shared leadership with our community partners. And there's other models that extend it to community-led, community-driven, community-owned research, community-owned scholarship. So this one I found immediately, but just think there are other models that are pushing and kind of say, if we do this as a university, we're dead. If we just do outreach, we know that. So just kind of, as we think of creating our academy, we have to kind of say, some people start at consultation and eventually get to shared leadership. It's not like every project is the same. So that's the other piece, to kind of think about where you are. Why do we care? Well, I just kind of listed a whole bunch of things of why I care. There's ongoing community mistrust. There's a whole challenge of the complexities of the world we live in, and if we don't have partnerships, we're not going to create solutions. The challenge, this is back to the outreach, the one-way transmission of, universities do this thing. We have the knowledge, right? We're going to tell those folks what to do. For those of us who did research, we talk about this a lot. What is the evidence of best practices? And there's the practices that we write up from our research results and get published in a journal, and then they're suddenly best practices. They need us to do it. But what about the community-defined evidence, the indigenous evidence, the practice-based evidence? What about and for me, as a long-time CBPR researcher, how do we bring those evidences together? And we're stuck sometimes at our academic side saying, oh, we have the evidence, because we've seen it published in the literature. And so just if we can open up this view in our academy of what is evidence, I think that would be really powerful for people. And also translating research into actions, policy systems. We need to always think about action results of and sometimes we don't even, again, there are many people, of course, in the world who just publish and don't think about the next step. And we don't want to do that at UNM. So I come out of community-based participatory research, so do my colleagues, Prajatka, Lorenda, others may be here as well. It's a public health orientation. So there are two definitions I just wanted to share, but we'll share each other's definitions. So I'm just sharing from myself. This is from the WKK Kellogg definition from 2001, where, you know, research is equitable, unique strengths that everyone brings, a research topic of importance, and the goal is to eliminate health disparities. The goal is action. The goal is not just, and then we wrote up a different one saying, even if you're not really doing big, formal NIH-sponsored research, it's any collaboration that's bringing information and data, and how do we make that available to all of us to build on community strengths for all the strategies that we need, again, to promote equity. So this one was kind of trying to get away from, it has to be huge research. It can just be coalitions working together. And we still do needs assessments. We still look at information, right? We all do. So we have our Center for Participatory Research, this long-term that Prajakta and Lorenda and Shannon and many others have been working on for a long time, where we've created all these tools. But it's been NIH grants since 2006, one after the other. And so what I'm hoping to bring, from my perspective and from our perspective, is a set of these tools. We're also going to ask other people to bring a set of tools that you use, that you think about. But today, Michael and I were hoping we could get to some time together creating the beginning of a river of life of our own journeys of where we've started ourselves in community engagement and where we want to go. This is what we've done all over the country, actually in different parts of the world as well. But generally our tools are based in a Paulo Freire reflection action cycles of, so just how do we create dynamic cycles of interaction with communities where we reflect together, we act, we reevaluate what we've done. And we have a model that we've created, and it looks very complicated here because it is, because this is the entire, I always say this is my life in one page. So this is the entire literature around this model. And we'll go back to it, and I shared it at the lunch. But it's really got a way to systematically think about community engagement. We all need to understand the local context that we're in, right? You know, Jemez Pueblo is different than Raymond Navajo, is different than the border. What's that local context that we live in and we breathe in and we learn from and all of that where we're working? Then who's and how do we create those partnerships? Who are we creating partnerships with? It's the who and then the how. How are we working on strengthening the trust that we might have? How are we building dialogue, and how are we dealing with conflict that emerges? It's all the who and the how. And so that's in the more complicated model, but just you think. So systematically thinking about partnering, then if we're partnering, it impacts all the actions that we do. I mean, if I just concoct something in my office, I'm not partnering with anybody. But if I'm out there in the community partnering, then it's going to change the research design, it's going to change the sample, it's going to change the surveys, it's going to change the practice, it's going to change the act, it's going to change the decisions. The actions are all going to change in the partnering. And then that impacts the outcomes. So we have a set of tools, how we use this model for strategic planning with communities. And it works. And for visioning with communities. So we'll go through some of that for the Academy. I just wanted to present a tool that we find really grounding and helpful. And hopefully it's something you can think about. Is this, you've maybe never seen this model before, but is it a tool that would be helpful to your own work? You know, because when I bring students in, we talk about how do we learn about partnering together? And what's the impact of partnering? And how do we learn about the context? So it really helps students to have a system, you know, because otherwise they're kind of saying, oh, I'm going to walk into a community and what do I do? But, you know, we like to give students prep, especially of how they think about, and we use the term partnering all the time. There, you know, there's engagement, but what does it mean to really partner is a different story. So I'm hoping that our Academy, we really promote the idea of partnering, because that means we have to set ourselves in a really important set of values. So our primary value for this in our work is it's not on communities, it's not in communities, it's with. And everything changes when it's with a community. That's the partnering, that it's with. It's not just in a, you don't just go into a neighborhood, but who do you do things with? So, and we have a set of principles, and I've learned a lot in my own work, and thanks to Lorenda and other colleagues from some of the tribes here and that I've worked with, that I've worked with, you know, since the 80s with tribal partners, and you know, you can't do this without knowing about tribal sovereignty. And I always think about what does it mean to take the same ethics of tribal sovereignty to every other community? You know, where the data belongs to the community, we never publish without our community partners, ever, ever, ever. So that kind of guidelines or expectations or requirements from the tribal IRBs and all, why don't we do the same ethics? So I'd actually love to have part of our academy be generating our collective set. This is a set of principles, right, from a discipline, but generating our own principles of how we would want our academy to be. So I'm sure share a lot in this room. I just want to go fast. This is the Freirean way of working, listening, dialogue, action. For those of you who know Paulo Freire, you know, it's constantly being open to learning and open to listening. You know, so that's the real important part of work in communities. I've recently learned about this Mi'kmaq elder, Albert Marshall, who talks about two-eyed seeing, or Etwap monk, where he's from Canada, First Nations in Canada. But this idea of this gift of multiple perspectives. I was at a national meeting the other day, and people were presenting this two-eyed seeing, that we can benefit in our community practice from narrative, storytelling, indigenous knowledge, and from Western knowledge together. It doesn't have to be one or the other. How do we do it together? And I think I put in here from us, our Center for Participatory Research, the Indigenous Health and Wellness Center, and Lorenda is leading our family listening program right now. But we've been trying for a long time to embody this idea of the knowledge from communities being as important as our empirical knowledge from the university. So there's Lorenda. You could ask her about family listening. She's still a little sick, but she came. So our task today, and the next period of time, the next year or two or whatever, we want to build on these principles, hopefully the principles in the room, not just the principles I just presented, but our collective set of principles. We want to build on what we know as best partnering practices. And I just want to say that our Engage for Equity work that we started with NIH funding in 2006 has identified a whole set of partnering best practices. We have surveyed 400 partnerships across the country. So we have ideas of partnering best practices. We have empirical, but that doesn't mean that there aren't best practices still in the communities that we can learn from. So again, it's this Western but we want to build on we want our faculty to know what the best partnering practices are, and we want to ask them what their own best partnering practices are. So we want to do this both internally. And we also want to build in this idea that we should have a constant collective reflection, which is what Paulo Freire offers us. That if we're going to build our faculty, they can't just do it and say, okay, now I know. Because you never know. I'm constantly learning. I'm constantly being told I don't know something, especially as a white outsider working in tribal communities. I'm constantly being told I'm learning. So, you know, and I've done this for more than 30 years. And we want to build on, you know, the broad array of disciplines. We want to honor our own histories in the room. So one of the things, you know, we thought of is, and talking with Tim and Michael, is can we develop first an initial single module, you know, a 3-hour module together, and what would need to be in that to train ourselves here as the first ambassadors. We want to develop an educational plan and a further curriculum, right, for more faculty development with ambassadors in different departments and colleges. And we want to develop, and this has been really an important contribution of Michael, a plan for a sustainable, supportive network, that it's not just coming to a training. How do we support each other to grow and learn in the practice? Because it's an ongoing, and, you know, link with other engagement efforts across campus. So that's kind of my view of the task in front of us. So I'm in the Center for Participatory Research, and I just want to be transparent. I did present a proposal to the provost that we would, as a center, be willing to lead this effort and this co-creation. We've done it a lot. I've done it since 2005, working in Latin America, building a whole 10 modules in Latin America in CVPR and empowerment. We have Lorenda and Prajatka and I. Lorenda started with me, and then Prajatka later, and many, like 10 facilitators. We've been running, and we keep changing it, our CBPR Summer Institute since 2009. So we've co-created lots of curriculum together. And then since 2 years ago, we got CDC funding to develop these modules out in the community. So we have a lot of curriculum development expertise, so I'm sure there are people in the room. But that was the, I want to be honest, I did make a proposal to Provost Holloway that he would provide some monetary support for faculty ambassadors on campus, for a supportive network, and for a trainer, so some funding for our center has never had institutional support. So if he wants us to lead this effort, that he would put some money in. So I'm just, transparency is what I believe in. And I think that's it. Oh, so the River of Life, this is what, so any thoughts before we jump into this? Because Michael and I thought it'd be fun to actually get and do some work together, for those who can stay, and really learn about each other. Because a River of Life is a metaphor we've been using for a long time, where we collectively create our journey together of our own, what we bring to this experience, with markers, with crayons, with construction paper, sometimes with magazines we cut out, and glue, with paint. But before I jump into that, because I want to catch Irene before she has to leave so she can see the River of Life. But any comments or thoughts on what I was trying to give you, my perspective, and and I think we can bring each other's tools into the room. We can, again, honoring each other's experiences. Yeah, Karen.
So I know enough about you to know that when you say co-design, it would be with community as well, right? And how would
We have to figure that out.
Yeah.
I don't know yet. I mean, this is the first time, but yes, how do I know that?
Yeah.
Is it?
Just,
Yeah.
How we do that, we can co-design, but it seems in the ethic of what we're doing, it makes sense,
Interesting. Yeah. Thank you. We haven't.
Oops.
Go.
And I'm thinking that as we started, we're thinking about co-designing the program so that we can build our capacity to co-design a larger program with community. But it's a really good point, because most of us have partners with whom we've worked a long time and have trusted relationships, and might welcome is a really good point.
So the CBPAR training, the Community-Based Participatory Action Research Training, we co-designed with the Department of Health, with tribal partners, with the health councils. It took a year to co-design it before we even gave the first module. So that was definitely, and with faculty and students as well. So yeah, we have to great question. We have to figure it out. Other thoughts?
I know we're short on time, but I wanted to ask if you could provide a little bit of context about the mistrust between UNM and communities, and whether there's been any repairing, or what's the current status, you would say, of that level of trust? It probably depends on communities too.
So I think the way I see it all across the country, there's a huge amount of trust with individual investigators.
Mm-hmm.
And there's not trust at the institution. And
Or with universities.
We individually who go out and spend the time and have spent the years of commitment, probably everybody in this room, that's where the trust is. Institutions typically, last year Prajatka and I were working with Stanford University. The hospital did not accept Medicaid patients, and they were saying, the whole campus was trying to be all this wonderful, we're going to do all this community engagement. And they said, but you guys don't even give us care. So it's the type of thing, and we've had a lot of ourselves, UNMH, not providing care to undocumented. UNMH has been very iffy about sometimes providing care, sometimes not. So as a whole hospital, as a whole university, which includes health sciences, there's been bad actors. Prajatka, you have to.
Just also say, from our cancer center perspective, LGBTQ care has been a big source of mistrust as well. We're just not, we've not done a good job of making our spaces trustworthy, right?
Mm-hmm.
Where people can come and actually feel safe and talk about their care more honestly. They don't know who they're talking to. So there's a lot of that comes up whenever we go out into the communities, to understand and recognize that the institution as a whole may not be doing the best job.
And then one of the things that happens a lot is a lot of us come from different departments into the same community. they said, don't you know that somebody just was here? You know, what are you guys doing? Don't you talk to each other? And so there's people say, well, you know, so then they start to say, who should I talk to? I mean, we've had that. Have you experienced it yourself?
Oh, absolutely.
How do you experience it?
Yeah, in that regard too, is that I feel like that we've done a good job of building individual trust with these community members, and then, but the UNM brand, for whatever reason, we just can't fix that part. We're doing everything we can as individuals, but then the brand still carries that mistrust. And I hear that more often than the reverse. I hear, like, we love UNM.
What's really interesting that it brings up is thinking about, in the bigger sense of the university making an investment in community engagement beyond the application, the Carnegie application, is that we might develop some metrics like community trust of the brand, as well as community trust of the scholars with whom they have direct contact. What do you think about that? Like, thinking about some outcomes, describing some outcomes we could see other than just numbers of people doing stuff.
And I definitely agree with you, Nina, about the coordination, the lack of coordination too. Is I feel like, in fact, Irene and I were just talking about, we're both having these conversations with APS from different perspectives, but it's also, but I had no idea that your group was doing that, and I don't think Irene knew that we were.
And Nancy's doing stuff with APS, I don't know.
And I would love to.
And Karen. And we used to do a lot with, I'm not doing it right now, but our group used to do a lot with APS and an alcohol substance abuse prevention program. So, yeah, we should have coordination of these kind. Well, maybe, I mean, the other thing I'll just say is that, again, from our Center for Participatory Research, we just received a major national grant to work with 8 institutions in the country to change internal policies and practices to make our own universities more trustworthy. And UNM is one of them, which we will, we had to randomize, we had 8, so we started this year randomizing, so we are working with 4. So next September, we start with UNM. So maybe if this group has some, you know, maybe we make it part of the academy of what are the ways to measure or understand. Projatka's been working on actually metrics of trustworthiness. So we have a whole, because we've done some work on it with the Mayo Clinic already with their, but we haven't done it with this whole university. So we're very interested in that, but I would value this kind of collaboration to kind of say, what could we do together to think about what, you know, it takes forever to get money out to communities. For those of us who have grants to do that, it takes forever in this institution. But anyway, Francisco.
So just another, I guess, learned thing, you know, after many, many years working in communities, it's how you approach them as well. And they usually come to us in many cases, and I've been working probably since like the mid-90s with communities and community work and community organizing as well. And there's a certain way to treat them as well, yes. And not overpower, not oversee them, not say, I have all the knowledge and you guys don't. And so really humble yourself to, you know, towards the community and how you actually approach them and how you actually want something out of it, you know, so you actually have to set the example as well and get your hands dirty. I mean, I love to do practical work, so you can't just go and say, this is how you make things, you know, you actually have to be there doing it with them as well. So, but that's in the design, the architecture field, yeah, so.
No, we do it in health as well. We're out there all the time.
Yeah.
And then you can't get reimbursed by the community. I mean, some of the stupid grants here on campus don't allow you to use the money for food. What do you mean? You can't do community work unless you bring food. I mean, it's real, you know, some pilot grants on the Health Sciences Center prohibit the use of the pilot grant money for food. I don't know about RAC grants. Do they allow you to use food for food?
Never applied for a RAC here.
Okay, but I mean, I'm just saying that there are university barriers that we want to challenge, Mike. And any help we can get, the better.
That's great.
So that'll start in September, but we can work with this group to think about it first. Yeah, Caro.
Kieran had her voice, her hand raised. Kieran, you want to?
Oh, no, I already said what I had to say.
Yeah,
I was
Irene.
thinking about some of the advice that, I see reading newspapers about responding to national developments. And part of the advice of people who work, at the grassroots level in community is to remain focused on the issues that you've been committed to. Because if we're all running around everywhere, then we really can't have deep engagement. And so for me, an effort like this can be most valuable if it's about, as you're suggesting, bringing people together so that we can support each other's work in ways that are feasible and not necessarily creating more work on the work that we do. So I think that there's a certain amount of important networking we can do, because, like a department like ours, we can't be at the front line of every struggle that the communities are. So we tend to focus on the high schools. That's where we can put our time and labor. But in other people's cases, it could be tribal communities, healthcare, and so how do we create greater knowledge about what we're all doing, greater networking, and greater support? Because I'm sure that will be an invaluable resource for all of us in this effort.
So one of the ideas initially is that there's people who couldn't come today, but the expanded group of people who are invited today become the first network. We become the first support network for each other, and as we co-create with colleagues, as we co-create what we want to share with other faculty. And we become the first realm of we train ourselves to be trainers in our own places, but we also support each other, and that becomes, we create the model that we want to extend out, that we do it in the way that we think it should be done. And that I asked, part of my proposal to the provost is that he provide incentives for faculty who become ambassadors. That it isn't just that you're doing it off the skin of your teeth too, but that that there's an incentive for faculty, and if we're the first group of ambassadors, and then there's an incentive, whatever they decide, from whatever the provost decides, whatever. And then we take it the next year to another invitation where people can apply to be an ambassador. But then we so we slowly expand a network out where people, and then if someone says like, hi, Doreen, if someone says, Francisco, you say, I want to do a training of this module with other faculty in architecture or whatever, and you say, well, someone co-facilitate with me so I don't have to do it alone. So we help each other, so that's the kind of, or Mike, you want to do it to political science faculty. We help, you say, I need someone to do it with me. And so we volunteer and help each other. And so that becomes kind of part of the network, is that we support each other to reach out beyond, and so all of these plans or processes have to be put into place and presented to the provost and da-da-da-da-da. But that's kind of a dream of, we do it ourselves. We figure out how we would like it to be showcased, because we feel like we're doing it the way we believe in. We're not just standing up in front of someone and talking. That's not what sharing and learning and co-learning is about. So we wanted to, I don't know if we should jump to, Doreen, do you want to just introduce yourself? Because you just walked.
My name is Doreen Bird. I'm from San Diego Pueblo, and I work with Nina and Shannon, College of Population Health.
So how do we define ambassador?
Oh, I don't know it yet.
No, and I was calling them fellows.
Oh,
but-
fellows. Somebody, but
but
Provost
the
Tim was
idea-
calling it ambassador. Maybe it
is
should be
great.
fellows. Maybe it should
Maybe-
be fellows. I don't know.
Well,
I don't know.
When I suggested it, I was thinking of the model where UNM was part of this multi-institutional project called Student Experience Project. And in order to involve more faculty in these, in a study around some practices to close achievement gaps, they offered it as the fellowship. Fellows got $1,000 stipend. We were expected to go to these, a couple of trainings, and we met monthly, the group just at UNM, and the bigger trainings were with all of the institutions. It was during COVID, like it launched in spring of 2020.
Ooh.
Good planning. But actually, it was fantastic to have that resource when we were all adjusting to this and thinking about, different challenges to access and learning in that environment. But anyway, so it was a real program, and there was a lot of, peer-to-peer learning, as well as the original. I think it started as a much smaller study. That study revealed success in certain tools and strategies, and so the trainings were around those strategies, and then we kept applying them in our classrooms and participated in surveys, so the students were surveyed at multiple points during the semester. So anyway, it was, and everybody's a fellow, and then we were asked to help bring that knowledge and those strategies to our units. Right?
So I actually proposed that the fellows or ambassadors, whatever, would get $3,000 to the provost. That's what I proposed.
For how much time?
A year.
Yeah, it's nice.
So I don't know. A proposal's a proposal. What the provost does with it, but I thought we should make it real. I mean, he might go to 1,000. Who knows?
Right, and that was determined, I think, by the multiple institutions and whatever funding they got for that project, the 1,000. But we had a lot of them here at UNM. I think more than 40.
I was just listening to some of the conversation and wondering, so the outcome could actually get to the trust factor, right? It could be about, we're doing this academy, and one of the first things we want to think about is how to have greater trust between, the university and community, and then the principles, which are all value-laden, right? So it would be about the ethic of community engagement in a way to build trust that should be spread across UNM to help build greater trust, right?
Mm-hmm.
And
more ethical and effective research, right?
And that gets to people in the room already have things that they're working on in certain ways, and they're doing it in certain ways. So it's not going to be something in addition to what they're doing, but they're bringing their knowledge and their community members' knowledge and all of that to the table, and it feels like something that many could use on our campus and build on, the year after and all the rest of it.
Right, and hopefully if people are a paid fellow or that for 1 year we would have this ongoing network for people, that it wouldn't just be a 1-year thing, and people could choose to participate as they, maybe the fellows do meet monthly in the year that they're chosen, but then the network is more of a quarterly network where we just grow it, and we grow a network of exchange, and one day it could be, let's bring everybody together who's working with APS, and how do we learn from each other and not fall over each other's feet.
It'd be cool to have some sub-networks.
Yeah, and so, I mean, we have the world if we want to make it. We can make the world what we, I'm a mentee of Miles Horton from the Highlander Center. We make the world by walking. We do it. We have to create it. We have to create it the way we want. So I
Be
think
positive.
we have to define together what the fellow or ambassadors are, but the first step is thinking, well, I don't know what, we thought the first step was having our own experience. So I want to just say what the River of Life is for those, many of you have done it in the room, but it's a metaphor for a journey. It has beginnings, it has headwaters, it has values at the beginning. Our families are our headwaters, and then the communities we grow up in, those that bring us our values, our teachers, or whatever. And then we keep our journey. And how did we end up in this room? Believing that we're here to support community engaged scholarship. How did we end up here? We had our journey to get here into this room, right? So there is a whole technology or facilitation around this where we say we have our histories and influences that have motivated us to support community engaged scholarship, community research engagement with ourselves and our communities. So we want to draw our own headwaters or springs, the values and resources that we each bring, our experiences. We want to draw our own history and our own current context, how it gets to our current context. And we want to acknowledge that our journeys are not just beautiful all the time and smooth, and you get these nice oases and whatever. There's barriers, there's waterfalls, there's dams, there's rocks in the river, there's rapids. So how do we honor that in the drawing of it? But there's also calm lakes. There's also mentors who've come in, tributaries, mentors who've come in. So we thought we'd use that table right there. We put the flip charts out. We draw our UNM river in the middle, and each of us then, how did we get to, what are we bringing to this UNM river of community engagement? And just to begin to learn about each other's experience, we've done this with lots of community groups. We've done it with lots of collaborations. We use this all the time. We're going to do it today with the Kansas University right at 11:30. Prajatka and I have a 4-hour workshop with our community partners and academics at Kansas University. And 90 people have signed up. So we'll see if 60 show up. 120 have signed up.
Wow.
And so we're going to be doing many rivers of life on Zoom. And so that's one of the institutions, and we'll be doing this river as part of our award here at UNM with many more actors at UNM too. But we thought we would do it ourselves. Here's a river, Lorenda and I and our colleagues in the Family Listening Program. This was done quite a while ago, but this is colleagues from Mesclero Apache, Raymond Navajo, and the Jemez Pueblo. They did a collective river because they all had their own individual histories, but then they did a collective river of histories together with many years of, and this is a Zoom river on the left, and this is a painted river from my colleagues in Brazil who work with homeless children and people down in the center of Sao Paulo who are facing tons of oppression by the government. But that's their river of working together. It's called Cor da Rua, the heart of the street is their work that they do together on mental health in Sao Paulo. So you can do and so they built a boat. See, you can build a boat. So those are rivers. But let's so I thought we'd just start, even just to start and see that, and then this is something that I would propose we bring to the Community Academy, because it's really powerful when people really do it.